Okay. Good morning. I am at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today is Wednesday, April 26, 2023. The time is 11:33 a.m. and we are meeting in room 500 of the John A. Wilson building, as well as via the Zoom internet platform. This meeting is being broadcast live on cable channel 13, as well as on my YouTube page at CMC Henderson. I'm calling this meeting to order to consider and vote on the fiscal year 2024 committee budget report for the Committee on Health. I recognize the presence of a quorum with myself, Councilmember Charles Allen from Ward 6, and Councilmember Vince Gray from Ward 7, and Councilmember Brianna Doe from Ward 1. My remarks are long, so I'm sure we'll be joined by the rest of the committee in due time. Today, we will consider and vote on the committee's fiscal year 2024 budget report and recommendations for the agencies under our purview. I will provide an overview of the committee recommendations and then open up the floor for discussion. The committee's budget report was developed after several months of hearings, testimonies, and meetings, as well as other forms of public engagement. The report provides recommendations for the agencies under the committee's purview, including the Department of Health, also known as DC Health, the Department of Behavioral Health, Department of Healthcare Finance, the Office of the Deputy Mayor for Health and Human Services, the Not-for-Profit Hospital Corporation, also known as United Medical Center, and the District of Columbia Health Benefit Exchange Authority. We also have several boards and commissions under our purview, but they do not have any particular budget authority. The committee held 8 public hearings on the mayor's proposed FY24 budget this March and April. We received testimony from members of the public and from government witnesses. And I want to thank each and every resident, advocate, community-based organization, leader, student, and government official who testified before our committee in person and virtually, or submitted written testimony. You will see your voices reflected in this budget report. Now more than ever, the district government needs to strategically deploy our resources to protect and improve residents' health, especially for the most vulnerable among us who have been, and in many cases continue to be, deeply affected by COVID-19. For fiscal year 24, the committee recommends strategic investments focused on improving access to critical healthcare services, increasing support for mental and behavioral health, including substance abuse treatment, strengthening our public health workforce, improving perinatal and children's health, and addressing key social determinants of health. I will now summarize the investments we are proposing to each agency. And then, like I said, we'll open up the floor. So I'll start with DC Health. The committee report recommends several enhancements to the Department of Health, including restoring funding for several key initiatives and programs that face significant reductions in the mayor's 24 proposed budget. First, under the healthcare workforce, the committee is pleased to restore and add new positions to the Health Regulations and Licensing Administration, also known as HRLA at DC Health. The committee regularly hears from health professionals who are frustrated with the licensing process, complaining that it takes too long or requires documentation that often is difficult to obtain or impossible to procure from other states. A difficult licensing process dissuades health professionals from becoming licensed in the district, worsening our shortages in terms of nurses, social workers, behavioral health professionals, and other crucial healthcare workers. The committee applauds DC Health for their efforts to improve their online portal and process for the health professional licensure, but believes that the agency does not have adequate staff to ensure timely processing of applications. And so the committee is restoring 3 positions to HRLA that the mayor proposed to sweep, including a supervisory health licensing specialist to support the Board of Medicine, and a compliant coordinator and an investigator who can support all of the various boards. The committee is also pleased to add 3 new FTEs to the food division in HRLA. At the performance oversight hearing, DC Health testified that the 16 sanitarians within the food division are insufficient for conducting required food safety inspections at restaurants, cafeterias, hospitals, and other covered food establishments. In FY22, the division only conducted a third of the required annual inspections. I repeat, the division only conducted a third of the required annual inspections for food establishments in the district. And yet the mayor's proposed budget would have swept 2 food division sanitarians, bringing them down to just 14 FTEs. These cuts would have further limited DC's health ability to adequately inspect food establishments and respond to consumer complaints, ultimately increasing food safety risks across the district. Thus, the committee is restoring some of those positions, as well as adding an inspector to implement Bill 25-68, the Street Vendor Advancement Amendment Act of 2023. As you all are likely to remember from last month, the final bill approved by the council creates a new micro enterprise home kitchen permit to create a pathway for small businesses preparing meals in their homes. We are pleased to fund the DC Health portion of the fiscal impact statement for that legislation, moving the council one step closer to full implementation of this important bill. Further, the committee's commitment to strengthening the healthcare workforce, the committee provides $1.4 million in recurring funds to fully fund the high need healthcare Career Scholarship and Health Professional Loan Repayment Program Amendment Act of 2022. This legislation was written and championed by Councilmember Gray. It creates a program available for the cost related to education, training, transportation, and examinations. The program would preference district residents and students educated in the district and healthcare professionals who demonstrate a desire to reside in the district. It requires that those who benefit from this program commit to working in the healthcare industry for at least 2 years. In FY24, this funding will pay for credentialing expenses for 150 nursing assistive personnel, 25 emergency medical technicians, and 25 paramedics. DC Health will continue to add individuals to this program over a 3-year span, with a target of reaching 600 nursing assistive personnel, 75 EMTs, and 75 paramedics by FY 2026. This funding also creates 1 FTE within HRLA to implement this program. To ensure that the district continues to receive critical animal care and control and rescue services, the committee restores a $2 million cut to the animal care and control contract at DC Health. The mayor's proposed budget slashed this contract by over $3 million from $5.9 million in FY23 to a proposed $2.8 million in FY24, as well as sweeping all of the capital funding for the new animal shelter and renovations at the existing animal shelter. Humane Rescue Alliance, the contractor who's provided the service in the district for the last 43 years, reported that the contract cut would force them to lay off 30 staff members or 50% of their staff and significantly reduce the services that they provide to residents in the district. This is just one example in which the mayor's team, in their attempts to balance priorities in a tight fiscal year, reduce core services that affect the health and safety of district residents. A compromised animal rescue control program not only impacts animals, but it puts district residents at a higher risk of animal bites and attacks that could go unaddressed and be repeated. The committee, unfortunately, did not have the funds to restore this contract, as well as to fully restore this contract, as well as restore the capital funds to the animal shelter. But we hope that the committee of the whole will consider further funding this vital service. In terms of the school nurse program, the committee reports restores $2 million to the Children's School Services Grant to provide school nurses to the district's 178 school health suites and approximately 90,000 public school children. The mayor's proposed budget would have decreased this funding by $4.5 million. The executive rationales that this proposed cut, describing the high current vacancy rates for school nurses, which Children's and DC Health are currently working on a new staffing model for school health suites. I met with DC Health to learn more about this proposed staffing model, and I generally support its efforts, though it's not clear that they can implement its current they can implement the plan with fidelity with the current proposed FY24 funding level. Dr. Andrea Boudreau of Children's testified at the budget oversight hearing that the new staffing model was designed under the assumption of current funding. Further, the staffing model hinges upon the ability to hire up to 130 new school health associates who will entail new salaries and HR support. The committee was unable to fully restore the $4.5 million cut, and will also encourage the committee of the whole to consider restoring this grant even further. Joseph's House. The committee report restores a number of important FY23 council one-time enhancements that were swept by the mayor in a proposed budget That includes $250,000 for Joseph's House, which serves residents mostly in wards 5, 7, and 8 with advanced HIV who have experienced chronic homelessness and a history of trauma, substance abuse, and mental illness. Joseph's House provides safe housing and a 24-hour nursing and personnel care, as well as assistance and access to benefits, address trauma and addiction. The committee is also pleased to accept some transfers for some other committees, including the Committee on Transportation and the Environment, of $170,000 to require dementia training for direct care workers, implementing the Dementia Training and for Direct Care Workers Act of 2019. This was funded in the FY22 budget, but was never spent because DC Health determined that they first had to develop regulations in order to implement the law. Now that DC Health has a report that the regulations will be published this summer, they are in a strong position to spend these funds in the coming year. Thank you, Councilmember Allen, for that funding. In terms of food access, the committee budget reinvests in a number of programs to support increased healthy food access. An investment of particular importance this year as the federal pandemic-related boost to the SNAP program ended in February of 2023, causing decreases in benefits of $90 for individuals and $250 or more for families. This decrease impacted 134,000 district residents who rely on SNAP, and who are now at a risk of higher food security. Well, I was hopeful that we would be able to fund our Give SNAP a Raise legislation. Unfortunately, we were unable to do so at the high cost, but the committee is pleased to accept some transfers from the Committee on Transportation and Environment to restore some of the one-time funding to these DC Health Healthy Food Access Grant programs, including $200,000 for Produce Plus operated by Fresh Farm, $150,000 for Healthy Corners operated by DC Central Kitchen, $25,000 for home delivered meals operated by Food and Friends. And I'd like to note that the mayor did maintain the $324,000 investment for Joyful Food Markets, so we did not need to restore those funds. But thank you again to Councilmember Allen for these investments from the Transportation Committee. In addition, the committee is transferring $822,367 to the Committee of the Whole to partially restore the mayor's proposed $1.5 million cut to the Healthy Schools Fund at the Office of the State Superintendent of Education, which is spent on school gardens, nutrition education grants, as well as school cafeteria equipment and training grants. This funding is vitally important to ensuring healthy school meals and nutrition education at schools across the district. We were not able to fully restore the $1.5 million cut, but we encourage the Committee of the Whole to consider adding further funding to this fund. All right. One more thing for DC Health. I promise we're getting there. So one contentious issue in the mayor's proposed budget is the transfer of the public health laboratory from the Department of Forensic Sciences to DC Health. This would align the district with 45 other states whose public health laboratories are located within public health agencies. During the budget hearing, DC Health testified that this transfer would allow DC Health to better respond to public health emergencies and create funding efficiencies, since most federal funding for the public health lab must come through DC Health and be transferred via MOUs to DFS. Under this new model, DC Health will keep the federal funding in-house. The committee report maintains the mayor's transfer of the lab, and we see the benefits of having a public health laboratory within DC Health. That said, we have several concerns, namely that appear to be very little coordination to date between DFS and health and DC Health, largely because neither agency seemed to be aware of the transfer into the release of the mayor's budget. We therefore have little information about the logistics. However, the public health laboratory will operate from a different location than the rest of DC Health agency. DC Health seems to acknowledge that the transfer will lead to a slowdown in operations temporarily, as the agency swept about 75% of the FY24 salaries for vacant positions at the lab. The committee therefore makes several changes to the Budget Support Act subtitle on the public health laboratory. First, the committee creates a requirement that DC Health publish an organizational assessment of the public health lab by December 31st of this year, in time for the FY25 budget process. And second, the committee establishes a non-lapsing public health laboratory fund where DC Health must deposit revenue generated by the lab that will be reinvested into the lab operations. All right, we're going to move on to the Department of Behavioral Health. The committee recommends several enhancements to the Department of Behavioral Health, or DBH. First, in terms of substance abuse and behavioral intervention, the committee report recommends providing $100,000 to provide retention and hiring bonuses aimed at attracting and retaining qualified staff for the Children and Adolescent Mobile Psychiatric Services, also known as CHAMPS, which is contracted through Anchor Mental Health. The committee is concerned about the district's ability to address crises experienced by children and their caregivers. Not only does CHAMPS respond to crises in residents' homes, but it also provides supports to DCPS and public charter schools. Given the rigorous and demanding nature of the work, the CHAMPS teams has faced difficult time retaining and recruiting talented staff. And to address this issue, this enhancement allocates around $5,000 for hiring and retention bonuses for the CHAMPS staff. The committee accepted a transfer from the Committee on Public Works and Operations of $200,000 and provides an additional $400,000 for a total enhancement of $600,000 to implement a new BSA subtitle, the Substance Abuse and Behavioral Health Services Targeted Outreach Pilot of 2023, which will pilot the effectiveness of an influx of direct support, relationship development, and resource brokering for individuals in need of substance abuse and behavioral health services at 3 locations in wards 1, 5, and 7, with high levels of concentrated outdoor drug use, which have been associated with crime, violence, and despair. Each of these areas would greatly benefit from consistent and intensive outreach and support to connect individuals with necessary services and resources and help them enter treatment and recovery. The 3 locations are as follows. First is the vicinity of the 600 block of T Street Northwest, in Ward 1 near Howard Theater. The second is between the 1100 and 1300 blocks of Mount Olivet Road Northeast in Ward 5. It's near West Virginia Avenue and Mount Olivet Road. And then the third is between the 3800 and the 4000 blocks of Minnesota Avenue Northeast in Ward 7, near the Dorothy Height Library Safeway corner of Benningen Road and Minnesota Avenue. In an ideal world, we would have had more funding to be able to provide funding for more sites, such as in Ward 6. And we will take this to the full committee, as well as encourage the Department of Behavioral Health as we begin to spend down the opioid litigation funds, continue funding more sites for this hands-on intensive outreach. I want to thank Councilmember Nadeau and her staff for the transfer of funds and for collaborating with our committee on drafting the subtitle. In terms of school-based behavioral health, the committee heard from testimony from students, parents, advocates, and practitioners advocating for additional funding increase to the CBO clinician grants. The committee agrees that adequate clinician compensation is essential to a strong school-based behavioral health program, but the committee decided against recommending an across-the-board increase for FY24 because the committee is confident that the vacancy savings for FY23 and 24 will allow DBH to provide additional CBO grant payments for signing and retention bonuses in the same manner in which they did in FY22 and FY23. To address the challenges regarding student access and resources with the school-based behavioral health program, however, the committee is proposing an enhancement of $325,000 for a new Budget Support Act titled the School-Based Behavioral Health Student Peer Educator Pilot Amendment Act. This pilot program creates a peer educator program for district high school students. Funding will allow DBH to provide grants to 1 to 2 community-based organizations who will provide training and supervise at least 100 peer educators. This pilot will prioritize partnerships with cohort 1 high schools and schools located in wards 5, 7, and 8. The pilot program aims to address the gap in access to behavioral health services. Peer educators will conduct classroom presentations and provide one-on-one sessions to teach mental health wellness information, recognizing the significance of social influence and peer attachments in the teen years. The pilot is based on evidence that adolescents also often seek informal sources of support, including friends, for their behavioral health needs. I'll next move on to the Department of Healthcare Finance. The committee is excited to fund the implementation of the Expanding Access to Fertility Treatment Act of 2023, which is before our committee, as well as the Committee of Business and Economic Development for Markup, which is expected next month. The committee is allocating $940,000 in local funds to expand Medicaid and alliance coverage to include diagnosis and medication treatment for infertility beginning in January 1 of 2024. DC will join New York as the only state offering Medicaid coverage for these ovulation enhancing drugs. Many individuals facing infertility are unable to successfully access treatment because of the expense. The committee is pleased to be able to fund the expansion of the Medicaid and alliance coverage to cover diagnosis of infertility. Under this bill, healthcare finance will also be directed to consult with the Federal Centers for Medicaid and Medicare Services, sorry, I flipped those, CMS, to determine opportunities to expand Medicaid and alliance coverage to include in vitro fertilization and fertility preservation services. Along with the Medicaid and alliance provisions, this legislation will also require private insurers to cover treatment of infertility conditions up to and including IVF and fertility preservation. And this requirement is set to begin January 1 of 2025. To implement this requirement, the Department of Insurance, Securities, and Banking must conduct an actuarial assessment to determine the cost of the mandate. Therefore, the Committee on Health is transferring $50,000 to the Committee on Business and Economic Development to fund this assessment. The committee is also pleased to allocate $269,280 to the Department of Healthcare Finance to enhance the personal needs allowance for individuals living in assisted living facilities and certified residential facilities from $100 to $130. The P&A is an amount of Social Security income a Medicaid-funded resident of a nursing home, intermediate care facility, assisted living facility, or certified residential facility can keep for personal expenses not covered by Medicaid, such as haircuts, clothing, dining out, cell phone bill, or gifts for family. Prior to February of 2023, residents in assisted living facilities were allowed a P&A of $100, while residents of intermediate care facilities were permitted only $70. This $70 P&A was increased to $100 in February of 23, but the existing $100 P&A was not, for assisted living facilities were not similarly adjusted. The committee heard testimonies from public witnesses from the long-term care community that a higher P&A for assisted living facility and certified residential facility residents reflected a greater level of independence and therefore greater personal expenses for those residents. Therefore, the committee was able to increase the P&A for those individuals. In terms of perinatal and infant health, a topic near and dear to my heart, the committee is excited to make two important investments in this area. First, the committee is restoring $400,000 in funding for the DC Diaper Bank and make that funding recurring. Previously, the Diaper Bank received $100,000 in recurring grant dollars and $400,000 in one-time dollars. Now the Diaper Bank will have, This will allow the Diaper Bank to serve over 15,000 families in DC in FY24 with over 11 million diapers, along with period products, baby formula, and wipes. Second, the committee is excited to receive a transfer of $225,000 from the Committee on Public Works and Operations to fund a grant to support home visiting program for first-time mothers eligible for Medicaid. In prior years, home visiting programs have received grants through DC Health, but the mayor did not propose to continue funding that portion of the home visiting grant. And so the committee believes that the home visiting program is important to maternal health outcomes in the district. We are further choosing to locate this grant funding at DC Healthcare Finance instead of DC Health because the committee believes healthcare finance should work to incorporate home visiting for first-time mothers into a Medicaid state plan amendment so that it can receive Medicaid funding as well as the federal match in the future. The local grant funding for healthcare finance will kick off that relationship that we expect to continue. And so this funding will implement the proposed BSA subtitle on First-Time Mothers Home Visiting Program Amendment Act of 2023, which we include in this package. Thank you to Councilmember Nadeau and her team for the transfer of funds. We're almost there, y'all. I'm really sorry. We are almost there. So the committee has proposed a couple of BSA subtitles in terms of reporting requirements for the healthcare finance. First, this includes a report on regarding medical respite care for individuals experiencing homelessness and a report on value-based purchasing under Medicaid MCOs. Additionally, MCOs will be required to report quarterly figures on medical service utilization and primary care services, which healthcare finance will provide to the council. To facilitate these reports, the committee is funding an additional $55,000 of local funds. Medical respite care would provide acute and post-acute care for individuals experiencing homelessness who are not able to recover from physical illness or injury while living on the streets, but who are also not ill enough to warrant an inpatient stay at a hospital. The committee heard testimony from district hospitals who have provided care to individuals experiencing homelessness and encountered challenges when preparing to discharge those individuals because they did not have a place to safely discharge them to. Additionally, the MCO reports will serve to enhance understanding of how MCOs are providing value to the Medicaid program. The reports will highlight whether MCO case management services are effective in connecting enrollees with primary care and avoiding emergency service utilization. Finally, the mayor proposed a BSA subtitle titled the Medicaid Hospital Provider Reimbursement that places a maximum on the amount MCOs could pay for hospitals. For outpatient services, the hospital payment cap is capped at 110% of fee-for-service rate. And for inpatient services, the maximum is the rate paid as of March 31st, 2023. The committee supports the mayor's proposed BSA subtitle overall. However, the committee is concerned that the subtitle will have a disproportionate impact on nonprofit pediatric acute care hospitals in the District of Columbia. Such hospitals face a significantly different funding model compared to other general acute care hospitals. Just as the mayor exempted a subset of hospitals from this subtitle, the committee does believe that there is good reason to at least lessen the effect of the subtitle on the nonprofit pediatric acute care hospitals. While we are not addressing this concern in the committee, I look forward to bringing these concerns to the committee of the whole in hopes that the council can adjust these funding challenges. In addition to the enhancements I've described, I want to just briefly talk about some of the things that we approve without changes. The committee supports the mayor's proposed $15 million subsidy for United Medical Center. The committee commends UMC for its proactive approach in planning for the future, despite its planned closure in 2025, and we anticipate seeing positive impact on UMC's future endeavors will have on the community it serves. The committee also serves the proposed budget for Health Benefit Exchange Authority. The HBX budget is self-funded by assessments on health insurance providers. We heard witness testimony about the efforts HBX has undertaken on health equity-based benefit design, including lowering cost sharing for diabetes care, as well as for pediatric and mental and behavioral health services. The committee is also excited for HBX's continued collaboration with OSSI to provide healthcare for childcare, which helps childcare development facilities provide affordable health insurance coverage to their employees. In terms of the capital budget, this recommendation will support the mayor's proposed move of $10 million of funding for Cedar Hill Medical Center up 1 year from FY25 to FY24. We support this move to ensure that this hospital opens on time in spring of 2025. When the medical center opens on the St. Elizabeth's campus, it will help address inequities and healthcare access and outcomes. This 1 year shift is also important to alleviating inflationary pressures from the construction sector and allow the hospital to begin purchasing medical equipment now to avoid supply chain delays that could delay opening of the hospital. We also support maintaining the $500,000 grant for the Produce Prescription Plus program, that's Produce RX, which serves 1,300 adults and about 900 children annually in the district. And we also approve, as I said, of the Joyful Food Markets, as well as $300 in one-time funds for the senior dental health services. The committee report does transfer out some funds to other committees to support key initiatives that are tightly aligned with the social determinants of health, like housing, public safety, and civic infrastructure. That includes $100,000 to the committee, on recreation, libraries, and youth affairs for a grant for Horton's Kids through DPR to enhance academic support, youth development, health, wellness, and family engagement in Ward 8. $500,000 to the Committee on Health to restore the Emergency Rental Assistance Program, $433,410 to Recreation, Libraries, and Youth Affairs to restore the DC Public Library Revenue Generating Fund for feature author, musical, and other cultural events, as well as exhibitions that are primarily at the MLK Memorial Library downtown, and $629,442 for the custodial maintenance of the DC Public Libraries for regular cleaning, pest control, and landscape services. We also transferred $350,000 to the to the Committee on Judiciary, Public and Public Safety for the Access to Justice initiatives at the Office of Victim Services and Justice Grants for financial assistance to organizations who are providing individuals with civil legal services and assistance. $50,000 to the Committee on Public Works and Operations to fund self-release automobile boots, which will bring that total to $900,000 for public safety and modernizing of our traffic enforcement programs. And as I mentioned before, a little over $800,000 to the Committee of the Whole for the Healthy Schools Fund at the Office of the State Superintendent of Education. Consistent with the key values and goals I laid out in my opening remarks, I believe the committee has thoughtfully and methodically conducted the oversight process for the agency budgets within the committee's purview. Perhaps the most used buzzword in budget season is "quote unquote" balanced. We balance the numbers, balance priorities, policy priorities, balance the trade-offs. In a challenging budget year, the committee's proposed budget not only balances prior funding commitments, but also makes real new investments in improving the health for all district residents. And with that, almost 30 minutes later, apologies. I'd like to open the floor for discussions and statements. Somebody speak so I could take some water. Oh, Councilmember Gray wants to speak first. Councilmember Gray.
Thank you very much, Councilmember Henderson. I appreciate all the work that you've done. And I want to thank you and your staff for all the hard work on this budget. I am especially pleased that the committee accepted the recommendation to move funding up to fully complete the new hospital at Cedar Hill. You know, it's a project that will much to create a high quality healthcare system for residents east of the river in the District of Columbia. I'm also pleased that the high need healthcare scholarship program and professional repayment, the loan repayment program bill has been fully funded. This legislation was fully introduced last year by me. Funding the scholarship is vital, in my opinion anyway, to fully remove barriers for people to become healthcare workers, which is desperately needed. We know that the medical training program will make people ready to work with DC Health. I know this will greatly benefit our low-income residents who want to work to support their families with a meaningful career. Finally, I want to thank you, Councilman Henderson, for your work with me and to include Minnesota Avenue in Ward 7 in the target substance abuse and behavioral health services research outreach project. So with that being said, Councilman Mason, thank you very much for all your work. And I want to thank you for your work to get us where we are on the budget today.
Thank you, Councilmember Gray, for your kind remarks. Councilmember Allen.
Thank you, Chairperson Henderson. First, let me commend you and your staff on a lot of hard work putting together this report and set of recommendations. As you said, it took about 30 minutes to get through, but all well worth it because there's a lot of good things here. And we know this is a difficult budget. I think there have been devastating cuts in many areas. You talked about trying to seek balance. We're all trying to figure out how do we say yes to the right ideas. And as I've said, going through this budget is trying to figure out how do we, unfortunately, we'll have to say no to some good ideas, but how are we saying yes to the right things? And so I know you're striving hard to do that. And as you've taken over this committee, just appreciate the hard work it's taken to the whole team as well to get here. There's a lot in this report and the recommendations to like. Let me thank a couple of key investments I want to note as well. One is restoring the cuts to the Health Professional Licensing Administration. I want to thank you for identifying the funding and restoring the positions that were cut in the mayor's proposed budget that would have affected staffing at the DC Health Professional Licensing Administration. One of the kind of constant constituent complaints and concerns I get is around licensing. Just this past week, my office assisted a local physical therapy business with getting an applicant their physical therapy license. It took them 7 months to finally get it. I think we can all agree this is taking way too long, and it appears that even DC Health acknowledges this office is understaffed, having requested more positions than were actually proposed. There's a massive need for trained professionals in behavioral health in the district, and licensing is an issue that has consistently been brought up to me as a challenge to meeting that need. So I'm glad the committee is trying to tackle that issue. I'd like to work with you, Chairperson Henderson, on getting to a place where our licensing system is capable of addressing the massive need that we have here in the district for behavioral health professionals. I also want to note the funding for expanding access to Fertility Treatment Amendment Act, fully supportive of your efforts to expand access to diagnosis and treatment of infertility. It impacts about 1 out of 10 people nationally. Yet health insurance companies provide less coverage and financial support for those that are seeking fertility services. It's important to note these services are expensive. The average cost of an IVF cycle ranges between $10,000 and $12,000. I know this committee had a hearing on the bill last year, and I look forward to the markup in this committee and on the Committee on Business and Economic Development in the coming weeks and months. Also, the proposed coordinating and community-based outreach program to confront the district's opioid crisis. Fully supportive of the substance abuse and behavioral health targeted outreach pilot, which is proposed in this BSA subtitle that would require DBH to provide grant funding to a 501c3 to provide support and resources to individuals who need help with substance abuse and behavioral health services in 3 listed locations. Those locations are in wards 1, 5, and 7. I note Ward 6 is missing, but I do look forward to working with you, Chairperson Henderson, on making sure this program is able to reach Ward 6 and as many neighborhoods as possible in the district that are seeing high rates of our opioid overdoses. And of course, funding a school-based behavioral health student peer educator pilot program is really important. Despite overwhelming need, there continues to be vacancies in our schools for behavioral health specialists. By the end of the school year, we're projected to have 90 clinician vacancies. While I understand DBH is awaiting the results of a study that will assess the financial costs of the student-based behavioral health program, I'm glad to see this committee is thinking of alternatives to meet the moment. The school-based behavioral health student peer educator pilot program is going to award grants to community-based organizations to educate and train students on behavioral health topics, and then have the students present topics in the classrooms, hold one-on-one sessions with their peers, and distribute educational materials. After years of struggles and trauma brought about by the pandemic, our students and young residents need all the support that we can get. And I fully am supportive of this idea as a way to address that need. Also want to thank you for the funding for DC Health's fiscal impact for the Street Vendor Advancement Amendment Act. This budget's funding that, and I'm very proud to support. It's currently under mayoral review. The bill creates a new permit designation within DC Health for small businesses that use home kitchens to prepare food. Glad to see that funding's been identified for the 2 FTEs at DC Health, so this bill can be quickly implemented and become effective. And lastly, I want to thank you for accepting a transfer from my committee to fund the Dementia Training for Direct Care Workers Act. There's approximately 10,000 district residents living with Alzheimer's disease and other dementias, and approximately 14,000 residents that provide care to a loved one with Alzheimer's disease or other dementias. In 2020, the council passed the Dementia Training for Direct Care Workers Act to require dementia training for direct care workers. This law has yet to be implemented, though, because DC Health has not adopted regulations. With DC Health saying the regulations are now in their final phase of review, will be completed by the end of this fiscal year, the funding is going to be there now to ensure the law can be implemented. I will end with one concern on Department of Forensic Sciences, and I appreciate you talked about this earlier. I want to reiterate something I said yesterday at the budget markup for the Committee on Judiciary and Public Safety, and I strongly oppose and am concerned by the mayor's proposal to break up DFS, which is supposed to be our neutral, independent, accredited forensics lab. As it relates to this committee, the mayor proposed transferring the public health laboratory from DFS to DC Health. And I understand this move makes some theoretical sense. DC Health is the primary customer of the DC Public Health Lab. 45 other jurisdictions across the country have a public health lab housed in their public health departments. But I do question the timing and necessity of this proposed move. And ultimately, I just don't think it makes a whole lot of practical sense. I think this committee shares some of those concerns, judging by the fact the subtitle now includes language requiring DC Health to perform and release a final organization assessment to determine how DC Health will incorporate the public health laboratory, which would be physically completely separate from the Department of Health, and accompanying its employees into that structure. There's a lot more I could say about this, but I just want to make sure I make my concern on the record and hope that we continue to have this conversation as we move along through the budget process. So thank you, Chairperson Henderson, to your team and staff, and I look forward to supporting the report and recommendations today.
Thank you, Councilmember Allen. Councilmember Nadeau?
Thank you, Chairperson Henderson, for all your hard work. Congratulations on your first budget markup. The report and recommendations for FY24 prepared by your committee represent a victory for district families. I want to thank you and your staff for all the hard work that you've put into it. I also want to thank you for working with me and my committee staff to ensure funding for several initiatives. First, thank you for accepting $225,000 from my committee to provide grant funding for evidence-based home visiting services for low-income, Medicaid-eligible first-time mothers. 2 years ago, in my role as the chairperson of the Committee on Human Services, I transferred funds to the Committee on Health to support the Still Leverage for Our Future Amendment Act of 2021. That subtitle provided the funding necessary to sustain the high-quality home visiting program for first-time mothers created by the Birth 3 for All DC Amendment Act of 2018. And last year, the Committee on Health preserved funding for the program. I'm glad to see this new iteration of the Health Committee also recognizes the importance of these investments, and I'm very happy to once again provide fundings for such an important program. Through regular home visits by registered nurses, this program will continue to improve maternal health in the district, promote hands-on parenting, and in the long run, reduce abuse and neglect. I also want to thank you for accepting $200,000 from my committee to contribute to a pilot program to provide targeted substance abuse and behavioral health outreach in 3 locations across the district, including in Ward 1. In my ward, there have been struggles with outdoor substance abuse and behavioral health in the vicinity of the 600 block of T Street. For years, residents, businesses, and other stakeholders have expressed concerns about the drug use that occurs around this area of T Street, and my office has worked to coordinate with various executive offices, local ANCs, businesses, residents, Howard University, Cleveland Elementary, and other stakeholders to address these concerns. Yet the behavior has continued and even begun to spread to neighboring areas. What we seek with this program is to provide targeted outreach to the area in hopes of getting people the help and treatment they so desperately need. I was also pleased to see the committee's recommended budget restores a critical grant to Joseph's House to provide nursing care and housing support to individuals critically ill with HIV, AIDS, or cancer right there in Ward 1. Finally, I want to thank you for funding the portion of the fiscal impact statement for DC Health to implement the Street Vendor Advancement Act of 2023, an investment that's critical to ensuring the success of this landmark legislation that will end the criminalization of street vending. It was a long road to get this legislation passed, and I'm thrilled to now see it funded. Chairperson Henderson, I appreciated your partnership in strengthening the bill by using it to create a new permit within DC Health for micro-enterprise home kitchens for small businesses making prepared food in their homes. And I'm grateful for your partnership now in funding the 2 FTEs required to create and enforce this new permit. By funding this legislation, we can move all vendors into full compliance with the law, enable them to successfully run their businesses and provide for their families, operate without unnecessary barriers and without fear. By doing so, we lift up the vibrancy of our community and community members. Thank you, Madam Chair. The committee's recommended FY24 budget truly prioritizes the health of our residents, and I look forward to voting in favor of the report and recommendations today.
Thank you, Councilmember Nadeau. And thank you to all of the committee members here for your remarks, as well as for your staffs and your collaborative nature in terms of how we put this budget together. I saw a picture yesterday of someone, it was a pyramid with a line and it said work. And then above the line was like the work that you see versus all of the work that takes place, which I feel like is this process in a nutshell in one photo. So I'd like to now call the vote on the Dias print that was circulated this morning. So it includes the charts. Thank you to the budget office. But I now move the FY 2024, the FY 24 budget local portion adoption amendment act recommendations. What in the, okay. And the budget support recommendations and the committee's budget report with leave for staff to make technical conforming amendments in consultation with the general counsel or the council's budget office as appropriate. All in favor? Aye. Aye. Okay. I don't hear anyone oppose, but I'll say any opposed? I think the ayes have it and the motion passes unanimously. Before we adjourn, let me pause to recognize the work of the folks who helped me as well as my staff in this process. Errol Spence Sutherland, Ann Phelps, Jen Budoff, Joe Wolf in the council budget office. Thank you so much. Nicole Streeter, David Guo in the office of general counsel, Kevin Lang in the office of revenue analysis, Adrian Reed, Andrea Dean, and Darren Schaefer in the office of the chief financial officer. I also want to thank all of the AFOs as well as the program staff at all of our agencies who took our phone calls and our texts and respond to our emails. And we're generally very collaborative in terms of the work that we were trying to do. I also want to thank my staff, Mike Schaefer, Heather Edelman, Ona Bacchus, Gabrielle Rogoff, Chantal Fuller, Anna Barris Vasquez, Marcia Huff, Boyd Jackson, Ashley Strange, Nico Polkin, and Taylor Coleman for all of their hard work, both on committee and overall just keeping the office operating as well as the other legislative items going in the midst of this process. There being no further business before the committee, we are adjourned. The time is now 12:19 p.m. Thank you so much.